Hello, everyone. Happy New Year. It's 2026. We begin the year January, and January is Firefighter Cancer Prevention Month. Really important in our industry. One of the biggest advocates and knowledgeable people is our director, producer, and content expert, which is Dr. Brittany Hollerbach. Brittany, talk to us about your passion for firefighter cancer prevention.
Thank you, Dr. Augustine. Yeah, I am not usually on this side of the camera, but I'm very excited to talk a little bit about a couple groups in the fire service that are doing some really great stuff in the cancer prevention space. So one is FCSN, the Firefighter Cancer Support Network. If you are not familiar with them, definitely check them out. Also, another group is called DetecTogether. And DetecTogether is also doing some great work, and they work also with FCSN. So we're all just one big group of folks working together. Cancer prevention is so important in the fire service, in the general population as well, but in the fire service specifically. Cancers are much easier to deal with when they're caught early versus in later stages. So DetecTogether, for example, has a really simple model you can follow. It's just 3 steps, firefighter proof, right? Easy to remember. So one is knowing your baseline. What's your normal feel like? If you have back pain on a regular basis, then back pain is not outside of your normal. That's in your normal, right? But if you don't normally have back pain and all of a sudden you have this persistent back pain, probably you should talk to your physician about it. Now, that is where number 2 comes in. 2 is if you have a sudden and persistent change in your health, talk to your physician. Again, this doesn't mean that it's cancer. It just means that you should probably talk to your physician about it. If you have a lump in your throat or your neck, if you have back pain that's persistent, if something's going on in the bathroom that's not normal, have a chat with your physician. And then number 3 then is chatting with your physician, right? So knowing you're normal, recognizing when something is different and persistent, and then having that chat with your physician. So 3 easy things you can do on the cancer prevention front.
Brittany, you give us science to the station, and this is one of the really important parts of science to the station is bringing cancer detection, prevention, and early treatment to us. Thanks so much for doing that, and thanks for your message today.
Absolutely.
Our
Thank you.
our timely message is about weather and being sick. And I haven't talked to anybody across the country in the past 3 weeks that hasn't talked about illness in the home, in the station, with their extended family, or at their work environment where everybody else is sick. So let's talk for a moment. We're in the middle of a really big respiratory season, a lot of flu, true influenza, which this year is influenza A. It is type H3N2, and it's subclad K for those of you really interested. And it is a drifted version of the H3N2 that we've talked about for 3 years now. The most prevalent influenza since COVID started to go down has been this H3N2. A lot of people have been sick with it already and are partially protected, but this drift of the H3N2 has allowed a lot more people to get sick. In particular, this season, it has been the elderly. And the elderly, unfortunately, have been getting it in large numbers in nursing homes and other senior aggregation places. And they've been very sick and in some cases end up hospitalized. And unfortunately, a lot of these people have died. They die not of the flu, but of complications of their other underlying diseases. So just be aware that flu can be hiding behind other causes of disease as we go through this time of the year. There's a little RSV, but we're getting really good protection in our young people with the new series of vaccines and other prevention methods for RSV. What I want to talk about today is what to do when you get sick. There are symptomatic medications for you, and I just want to reiterate a couple really important points. Cough medicine is for people who have non-productive coughs at the end of the illness. The vast majority of the respiratory bugs going around now have been lasting for 3 weeks. That is 3 weeks of cough. And sometimes you feel better and then you feel worse. And every day you're struggling because late afternoon, and then when it comes bedtime, you're coughing, 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 and you're up all night. In the early phase of you having a respiratory illness, whatever is causing it, your body is desperate to get those bugs out of the body. And how your body handles it is you cough and cough and cough. That is what we've referred to as a productive cough. It's doing something good for you. You do not want to suppress that cough. That may be the first 3 to 5 or 6 days of illness. At about a week, that cough becomes dry, it becomes irritating. You get a headache and you get chest pain from coughing so much, and you lose sleep. It's at that point where cough suppressants, either prescribed by your doctor or over the counter, may work. And I urge you not to think of cough suppressants the first couple days, either thinking it was going to make you better or suppress your cough, which it cannot do. Your body is overriding anything that you can do to suppress it and is coughing. Second treatment is all of the things that go along with reducing a fever, both acetaminophen, Tylenol, or one of the anti-inflammatory drugs like ibuprofen work very effectively in reducing fevers. Those are, in general, very good medicines. We talked earlier about acetaminophen being an extraordinarily safe medicine with billions to probably trillions of doses of acetaminophen given across the globe for people with fevers and aches and pains. It is safe in pregnant women, despite what has been said recently. So acetaminophen, a very well proven anti-inflammatory, anti-febrile medicine, and very effective. Let's talk then about the medicines used for infections. If your doctor thinks that you have a bacterial infection, your doctor will prescribe an antibiotic. It can be a form of penicillin. It can be a cephalosporin. It can be a medicine like azithromycin. It can be a medicine that has a couple of other types, erythromycin and some other things that we use for bacterial infections, or when the doctor thinks that there's a risk that your viral infection can turn into a bacterial infection, and that's usually in people who have a history. We also have antiviral medicines, and the two that are most prescribed in this country, oseltamivir, or better known as Tamiflu, twice a day, 5 days, generic, low price, relatively safe. It can cause some nausea and vomiting in susceptible people. And it is likely to reduce the amount of time that you have the flu. It has to be taken within the first couple of days of you having symptoms, and it is by prescription only. The second medicine that is relatively newer is baloxavir or Zofluza, which is very attractive because it's given a one-time dose. So you talk to your physician about the time that you have onset of flu. And in some cases, this is when you know a family member or somebody you've worked with has had the flu, and you're beginning to feel the same symptoms. And flu is a wipeout disease, and generally people know right away. This one-time medication, Zofluza, you take it orally, and it reduces the amount of time that you have an infection. We believe it reduces your infectivity to other people. And in certain circumstances, it has been known to reduce the spread amongst the household. What I want to tell you, those flu medicines are prescribed by some doctors. Some don't really believe in them because they don't think that it improves you enough to overcome some of the side effects of it. I also want to tell you there's a lot of other viruses circulating now, and a lot of you have had colds, and you've had laryngitis, and you've had these ongoing waves of feeling infected, of feeling very fatigued, and there's no single medicine for that. That's rest, flu. Don't go to work and spread it to other people. Take care of your symptoms with other medications. We unfortunately are in a big respiratory time. We're probably a little over halfway through it. That's the good news. And it's likely within the next 6 weeks. So that puts us about to March the 1st that we will be through this in our country. We're looking forward to a really good spring, but let's get through this now. Brittany, thanks for the really good cancer prevention message that goes not only to our firefighters, EMS people, and law enforcement officers, but to the community in general. And please stay healthy. Don't go to work sick. Wear a mask where appropriate. Take medications when needed. Thanks all. This is Doc Talk for the middle of January. Look forward to talking to you when the weather gets a little bit warmer. Thanks.